I'm Melanie Schaefer. This is Valley Health Minutes. Thanks for being here. October is National Breast Cancer Awareness Month. Did you know that 1 in 8 women will develop breast cancer sometime in their lives? It's a shocking statistic. So we're talking today with obstetrician and gynecologist Dr. Ellie Hood about what we can do to diagnose, prevent, and try to get ourselves ready to take the best care of ourselves. What are some of the things that women should be doing for prevention?
Absolutely. Well, the most important thing that somebody can do is to keep their annual gynecology appointment. That way their doctor can do their clinical breast exam, feel for any abnormalities, and most importantly get that screening mammogram ordered.
So once a year. I know self-exam is always so important, but it can be very intimidating. How important is it that women are doing it on a monthly basis?
Well, not so much just a self-exam, but if they're just aware of their breasts, that's really important. So monitoring for any skin changes that they may see, monitoring for any sore areas, making sure that, both breasts look symmetric and they don't see any abnormalities outright. That would be important.
Not just by touch, but by sight. Just kind of check yourself out in the mirror and make sure everything looks right.
Absolutely. I mean, if they want to go the next step and do a self-breast exam, that's great. But just simply being aware of your breast is super important as well.
Let's talk about the self-exam. Are there resources out there that can help women get a little bit more comfortable with how exactly to do it? Because I think we have a general idea, but it's always helpful to have more tools sort of in your toolkit to help you do a better job at it.
Absolutely. I mean, they can definitely ask at their annual exam, and we can walk them through that. So the most important thing is to do it at the same time every month. So if you're still having periods, you want to do it right after you have a period. If you're no longer having periods, just pick the day of the month that sounds good to you, like the 15th, and go ahead and go forward with your exam. You can do it in the shower, lying down, you can look in a mirror, but you just want to be checking every area of the breast and making sure that you don't feel any new lumps.
And I'm sure there's all kinds of resources online that people can look at too and get more familiar with it. But I love the idea of talking it over with your doctor and them showing you in your annual appointment how to do it if you're not comfortable. Sometimes people don't have insurance coverage, and getting that mammogram can be tough. What help is there out there?
Yeah, I'm really glad that you asked that. Here at Valley Health, we have a wonderful program. The abbreviation is BCCSP, and that pays for an annual exam for the patient to come in and be seen by the provider. They get a full breast exam, they even get a pap smear, and then we sign them up for a mammogram through the program. So that program will pay for that mammogram, and it's just a really great resource. We've got a lot of patients that take advantage of it, but hopefully, we'll have more patients take advantage of it if they know that they don't have insurance and they need a way to get a mammogram. It's an excellent option.
Everyone needs to get this test done, so there's help out there. And if you do get an abnormal mammogram, what's your first step?
Right. Well, I mean, the first step is not to panic. So a lot of times it's just that the radiologist didn't get a great view of the tissue, and so they just want to call you back to take some extra images of that area. So it'll usually be a different type of mammogram called a diagnostic mammogram. Sometimes we'll do an ultrasound as well, and then we'll go from there, determining what needs to be done next.
There's hardly a person out there that hasn't had breast cancer touch them in some way, a friend, a family member. What else should we be doing about awareness, though? Because it can affect so many women.
Absolutely, and early detection is really the best prevention, and I think that we could honor those people by just taking care of ourselves, taking the time to take care of ourselves. Make sure you go to that annual GYN appointment. Make sure you go to that screening mammogram appointment every year.
And encourage the women in your life to also take care of themselves. And we all have moms, daughters, cousins, friends, so we all need to encourage each other to take those proactive steps for our health.
Right, lead by example.
All right. Dr. Ellie Hood, thank you so much for being here. So many great tips, and I hope people keep this in mind as we observe National Breast Cancer Awareness Month. Thanks for being here. We'll see you next Monday.